Good evening and welcome to Partners Member Listening Session for Cabarrus, Union, and Stanly Counties. It's a pleasure to meet you all. My name is Allison Crotty and I'm the Member Engagement Director at Partners Health Management. Before we get started, and as people are popping on, we just have a couple notices. Just a reminder that we are recording this session.
Hola a todos, yo soy Allison Crotty, estoy encargada de los servicios del miembro. Antes de empezar algunos avisos, recuerde por favor que esta sesión está siendo grabada.
If you wish to remain anonymous, you may change your name using the three dots next to your name in the participant. You may also turn off your camera. And if you have a question, you can submit anonymously in the chat. You'll be able to raise your hand and be called on to speak in just a little while.
Si usted gusta, puede mantenerse anónimo, puede cambiar su nombre ahí mismo en la reunión. También puede dejar su cámara apagada. Y si tiene alguna pregunta, puede someter su pregunta anónimamente. También puede levantar la mano si tiene una pregunta y con gusto le llamaremos por nombre.
As you can see, we have a Spanish interpreter available, and you can access the rest of the meeting being interpreted for you by calling the number that is being chatted in, and I'm going to read out that number. It is 704-842-6304. The access code is 501-7793.
Como pueden ver, tenemos un intérprete en español. Si usted gusta seguir esta reunión completamente en español, por favor marque 704-842-6304 y el código de acceso es 501-7793. También ese número se encuentra ubicado en el sitio de chat donde usted puede leerlo. Cuando usted entra a esta llamada, por favor, de ponerse en silencio y toda la reunión será traducida en español.
Our invitations for future meetings are being translated, and we will have more language and communication supports available for the rest of our meeting series to better support everyone.
Todas nuestras invitaciones y reuniones en el futuro serán interpretadas en español. Si usted necesita esto, por favor, sepa que estamos aquí para darle el mejor servicio posible.
Questions and answers tonight will be added to our frequently asked questions and answers on our county realignment webpage for members. Okay, we're going to give a few minutes for people to move over to the conference call for Spanish interpretation.
Si gusta estar en la reunión con todo traducido, por favor marque el número 704-842-6304 con el código 501-7793.
Again, thank you so much for joining us. Tonight, we want to hear from you. We're excited to work together to educate, empower, and support those that we serve. Tonight, please share with us what we need to know about the uniqueness of your areas. Share your thoughts on what you or your family member need from partners as your local management entity, managed care organization to support you in your communities. We've already received some questions from our county questions email box, and we hope that you'll continue to submit those over the next few months. And and there will be a few surveys that pop up. You could fill that out for us, please. So this is which of the following best describes you as a participant and attendee here today. Okay. All right. As you can see, we have a lot of partner staff here tonight to hear from you, including our CEO, Rhett Melton, who would like to say a few words before we begin hearing from you. Rhett?
Thank you, Allison, and good evening, everybody, and thank you all for joining us. We're really excited to have this opportunity to connect with you, and as Allison mentioned, look forward to hearing from you so that you can help us through this process. I just wanted to take a brief moment and just introduce you to partners if you're not familiar with us yet. We look forward to the continuing relationship and getting to know you and work with you, and want to just take this moment to give you a brief overview about partners. As people ask me to describe us at various meetings, including the county meetings that we had with each of the counties, I tell them that it's easy for me to describe partners with using 5 words to kind of use that to describe us. The first word that's important for you to know when you're thinking about partners is our name. We were very purposeful when we selected that name, not to just put on our envelopes and business cards and letterheads, but to describe how we view our role. And so as we think about the word partners, we believe that we are first and foremost a partner with you, the members and family members. Our mission is to help individuals find the care that they want, find the care that's beneficial to them, and to be a partner with you through the journey of health. One of the things that we often hear is members and advocacy groups describe nothing about us without us. And in partners, we think of similarly that we're not trying to do things to members. We're not necessarily trying to do things for you. We want to do things with you. We want you to be empowered. We want you to direct what you want out of services and how you want us to help you. And we believe that we're your partner every day through that journey. Secondly, for partners, we believe that we're a partner with our providers. As you know, the partners staff, the LME MCO staff doesn't directly provide the care that members receive other than care management and other member engagement connections. But most of the formal care is delivered through the network of providers. So we believe our role is to be a partner with our providers. We've adopted that strategy since we became an LME MCO. We operate at what's considered an open network. We want all quality providers to enroll with us. We don't limit the number of providers who can be a part of our network. And we believe that's important. We believe that an open network, a large, robust network, allows you, the member, to have more points of access. There's more opportunity for you to find care. I also believe that more providers gives higher quality, because then everybody has to meet the member's needs, not necessarily just the needs of the provider, but meet the member's needs in order for them to remain a part of the network. And I also believe that more members or more network providers gives choice. You know, we all have some very good providers, but some of those just aren't the right fit for a particular member. Doesn't mean they're a bad provider. It just means it's not the right fit for the member. And we want there to be an array of providers to give you, the member, the choice to find care when and how you want that. So when we talk about our relationships and our name, it's partner to our members, it's partner to our providers, and then it's also partners to our community stakeholders. Partners has never wavered from our role of being a point of connection, a partner, if you will, to our departments of social services, our local health department, our local United Way agencies, all those community organizations that are also significant part of our members' lives. We believe that we have a role to stay connected and engaged and help together create the opportunity for care to be successful. So we believe that we're a partner to those community organizations. So when you're thinking about us and who we are, always remember that name, that it means something more than just those words on the letterhead or the words on the business card. And then up under that, when you see that name, you'll see 4 words up under our name when you see it. And it says improving lives and strengthening communities. And for us, that's basically our mission statement boiled down into 4 words. That's what we are all about. Our mission is to improve the lives of the members who seek care and to improve the community and make the community a stronger place for everyone. And so everything that we do, all of the decisions that we make are always going to point back to those 4 words. That's what drives us with our development of becoming a tailored plan. That's what's driving our process as we go through these county, always looking back at those 4 words. How do we improve lives and strengthen community? And how do we be a partner to members, providers, and community stakeholders? So just as we kind of transition the program, I've got to go to another meeting, so I apologize for having to step away, but I did want to be with you tonight and say hello and welcome you to the Partners family. And also just to make mention of one thing, that's a shared commitment by partners in each of the counties that are transitioning with us. And that's a commitment for a seamless transition through this process. We are committed together, both partners and the counties, to make sure that the transition process is as seamless and smooth and effective for all the members. And that's really why this is such a critical process. It will help us to hear from you how to make sure that's a smooth and seamless transition. This is not the only time that we'll need your voice. We need it all the time. So there'll be more opportunities like this, but I encourage you to help us partner together to go through this journey, not just for the transition, but everything that's to come, so that we build the system that you want and you need in your community. So again, Partners is very excited to be here with you on this journey, excited to be here with you tonight, and look forward to all the good that's to come together. Thank you, Allison.
Thank you so much, Rhett. We appreciate that. So next we have Delton Russell, who is a member engagement specialist for Cabarrus Union and Stanley counties, who will open us up for comments and questions. Delton, I'm hand you the baton.
Thanks, Allison. Appreciate it. Hey, everybody. Delton here. So first off, I want to say, if you feel comfortable turning your camera on, we would love to see your face. If not, that's totally okay. If you feel comfortable turning your mic on, we'd love to hear you. If you got any questions to ask. If you don't feel comfortable, that's not a problem. We will say, you can always type your question into the chat box. But if you do want to turn your mic and camera on, whenever you have that question, if you would just hit the raise your hand button, so that way we can see that you've asked, or that you're ready to ask a question, and we can acknowledge that for you. But anyway, so I just want to open the floor up, and while you guys are thinking about doing, thinking about what questions you'd have to ask or whatever, we're gonna have a quick survey, and we'll see what that turns out. You can see we've got a strong representation in Cabarrus Union. Stanley's pulling in. All right.
Hey, Dalton.
Yes.
Hi, this is Ashley Oria Adams. I was 10 minutes late to the meeting, so I apologize if you've already answered this question, but we're in the midst of submitting the next 6 months of behavioral plan through for ABA therapy for our son. And they mentioned to me that we were not going to be transitioning from Cardinal to Partners until January 1. Do you know, when you speak about smooth transitions, like when is that happening for Cabarrus County?
I'm going to hand that off to a subject matter expert to answer that question for us.
Okay, so that transition is actually happening September 1st. So for the 3 counties, Stanley, Union, and Cabarrus, this will begin on this September 1st. The one that is starting in January is scheduled to be Forsyth County, if all approved and goes forward. Rachel Porter could probably correct me.
No, Allison, I'm Rachel Porter. Hi, Allison is exactly right. The first 3 counties, Cabarrus, Union, and Stanley, will transition on September 1st. And if approved, if the secretary does approve, the realignment, Forsyth would go live on January the 1st.
Okay, wonderful. Thank you for
so
that.
much.
Thank you for that. So in that case, are you guys picking up the same, what do we call them, resources? Is there going to be, like, for example, our company is PBS. Is PBS also transferring their transition or transitioning their contract to Partners?
Ashley, my name is Beth Lackey and I'm the Provider Network Director. We are working with the providers who are actively serving members and have active authorizations, or who are currently contracted with Cardinal, serving Cabarrus, Union, and Stanley counties. As Rhett indicated, we also operate an open network. So we also have providers that are requesting to come in. We are working very closely with our counterparts at Cardinal for those transitional purposes. So we have several components happening as it relates to that, with providers that we're working to ensure that can continue to serve members September 1st for member stability, continuity, and provider continuity. And then we have also ensuring that any authorizations that are in place, we are working through that process as well. I hope that answers your question.
Absolutely. My biggest concern is just that there's been a lot of transition, and I wasn't sure if there was going to be a gap in service.
No, ma'am. Our plan is for you all to have services August 31st, and then those services would continue on September 1st.
That's great news. Thank you.
Thank you for asking. All right, so does anybody else have any other questions? I'm sure there's lots of them out there. All right, so I'm going to ask a question, or I'm going to pose a question from our FAQs from our website. So first is, does Partner limit the number of Consumer Family Advisory Committee members who are on the large CFAC team to 1 person per county?
Good evening. My name is Shirley Moore. I'm the liaison for our Consumer Family Advisory Committee. For those of you that may not be familiar with the term CFAC, that is the acronym that we use for Consumer Family Advisory Committee. At the present time, our CFAC is an independent and self-governing group, and we provide valuable insight and feedback to partners to identify any gaps in services, needs that members might have. And in doing so, we offer the opportunity for our members to participate in multiple internal committees, and we have 3 voting members on our partners board. Partners values our CFAC members, and your input is most important. One of the things that we're currently with our CFAC, we have 1 member representing each discipline per county. So each county has 3 representatives. As we start the realignment process, we're talking with the counties, Cabarrus, Stanley, and Union to understand and determine how that process will continue, and certainly to take suggestions for change. We had a meeting on Monday night that was very successful, that started that conversation. And I ask that if there are any additional questions about CFAC, the application process, that you would reach out to me, Shirley Moore, and I would be happy to answer those for you. Thank you for the question.
Thanks for the answer, Shirley. So we got a good CFAC answer there. Does anybody else have any other questions that they would like to ask?
I have a question.
Yes, ma'am.
My son is on a wait list with Cardinal. How will this affect the kids that are on the wait list?
That's a great question. Thank you for asking that.
So this is Tammy Gilmore, and I'm the Director for Care Management for the Intellectual and Developmental Disabilities population. And I think you're probably referring to what's called the Registry of Unmet Needs for innovations, for the innovations waiver. Is that correct?
Yes, that's correct.
So if someone's on the Registry of Unmet Needs, you're on there with a specific date and time of day, actually, that you requested to go on the list, and that would continue. So your loved one's name would transfer to partners with the same date and time waiting. So if you've been waiting for 8 years, you will still have been waiting for 8 years. So you won't have to start over. Your name would continue on the waiting list.
Do you think it might move faster now that it's broken off into different counties?
I can't say that it would move faster. The way that, we haven't had any new innovation slots in North Carolina for some time. Each year, there's a small number of what are called turnover or rollover slots that can be allocated. And those are allocated on a per capita basis. So each county usually gets at least one, sometimes more. I'm not sure that it would go faster, but we can certainly talk about that offline if you'd like to talk about it more, and I can kind of explain the process to you.
I appreciate your help. Thank you.
Thanks for asking or answering that, Tammy. I know that that's a question that I've heard quite frequently out in the community in the past couple of weeks. So with that said, any other questions? Who'd like to go next?
Dawn, I'm going to read. Oh, I'm sorry. Go ahead.
Oh, it's okay. I'm sorry. It's just Ashley. I'm trying not to hog the floor, but I have so many. I have so many questions as our son is 20, and apparently at 21, he is going to like some B3 services while he waits on the Registry of Unmet Needs waiting list is going to end when he turns 21. So I do just have a couple of questions. And one of them is, will this parental advisory committee that I guess Shirley was talking about, like, does partners plan to coordinate services with schools? So in Cabarrus County, we have high schools that have special needs programs, and the biggest disconnect between Cardinal and our community is the fact that they don't talk to one another.
That's a great question. Tammy, do you want to address some of that? I know that we do a lot of coordination with schools through our registry team and our member engagement and community engagement teams. And then we also offer a lot of training for the service array for intellectual and developmental disabilities across the age span. So I know Tammy might be able to address if, how care coordination care management, we call it, would be able to assist as well.
Yeah, I was just gonna, I was gonna say some of the very same things you said, Allison. We work really closely with the school systems related to educating the school system staff about how to refer individuals for services, how to get children even at a young age on that registry of unmet needs. But then also on the transitioning age youth, you know, once the child turns 16, 17, 18 years old, and you're beginning to think about what kinds of services and supports are going to be available when my child finishes school. That's a big concern for a lot of individuals and families. And so we work really closely with the school system, and they often refer individuals to us to have discussion about what are those resources available at the age, you know, oftentimes it's age 22 when the person finishes school.
So Tammy, thank you for that. So you're saying that you already have an established relationship with Barbara, the EC director at Cabarrus County Schools?
No, we currently have a relationship with the EC directors in the counties we currently support. We would need to establish that relationship with Cabarrus County.
Perfect. Okay. Well, then I would love to talk to you offline because I am one of the parents on the parent advisory committee for Cabarrus County Schools. And I would love to be that like conduit between the two to help bridge that gap.
Great.
Awesome. Thank you for asking.
Thank you for that.
Yeah. All right. So we have Amy has raised her hand. Amy Brindle, if you'd like to ask your question.
Hey, Delton, thank you so much.
Yes, ma'am.
I just wanted to add one of the things that we really like to see with CFAC members is to be engaged with the different county collaboratives. And in those collaboratives, I mean, some of the counties have 75 to 100 members, which includes a lot of the school systems, plus anything that might be integrated with the school system. So that is another wonderful way that we reach out, not only through partner staff, but also through the CFAC. And I know that one of the ladies said that she was with a parent committee. Now, just to clarify, with CFAC, it's consumer and family advocacy. So you can be a consumer or a family member of a consumer to be on CFAC. So thank you, Delton, for letting me just jump in there and give my little 2 cents worth.
Of course, we're grateful for the information that you share and appreciate your service. All right, so does anyone else have a question? Who's going next? Otherwise, I'm going to have to call on Ashley again.
Well, I was going to read one aloud, Delton, that we received, but it may have been answered. So if you need further clarification on this, Jessica, just let us know. But it was, how will this affect the waiver list for our son? We have been on the list for 6 years and urgently need help with our autistic son. And Tammy, I believe you covered that. But if you have a follow-up question, you can feel free to submit it or unmute yourself and ask anything else.
Yeah, if you've been on that list for 6 years, you would still have been on the list for 6 years. That's one concern individuals and families have had. It has been, gosh, do we have to start over? Do we have to go on the list new? And the answer to that is no. We would want to speak with you when September gets here about what services might be available to your son outside of the waiver. Particularly if he's receiving nothing now, there may be a service available through the B3 service array or through state-funded services, something that he can get while he waits for the innovations waiver. So that's something that we try to actively work on, is helping people access the services that they can while they do wait for the innovations waiver.
Yeah, I could see where that would definitely be a absolutely massive concern for people. The fear of starting over again would be overwhelming, no doubt. Okay, so who's got the next question for us?
Hi, I have the next question. My name is Maria Shannon and I live in Union County. And I have several questions, but the first one is that for consumers that only have B3 services, that means Community Navigator, supported employment, and respite, are those services still available after the realignment? And are they limited? Because the web page says that it's just if there are funds available. So I would like to know if families that are already receiving B3 services are going to continue receiving those services. That's my first question. I'm going to ask my second one.
We can go ahead and
Okay.
take that one first if you like. Tammy, do you want to go ahead and take that one?
I was going to suggest that Charity
Charity, go ahead.
respond to that one.
Hi, my name is Charity Bridges. I'm the Director of Utilization Management here at Partners. And what that means is I work in the department that handles all of the authorizations for services. And our goal is to ensure that if you are receiving service on August 31st from Cardinal Innovations, then you will be receiving the same service in the same amount on September 1st from Partners. It should be a seamless process and you should not experience gaps in service.
Okay, thank you. My situation is this one. My son receives B3 services, but we haven't had the opportunity to, get those services because the lack of providers and the staff in Union County. So my second question goes to, are we going to have or expand our net of providers in this area? And for people that have the service authorized, but they're not receiving the services due to the lack of staff, are we going to continue with the service even if we don't have it by August 31st?
So if I understand the question correctly, it's essentially, if I have the service authorized, but I'm not actually using the service right now because the provider can't find the staff, am I still going to be able to have the service? And are you guys going to be any better at helping the providers get the staff?
There you go.
So
Thank
that I
you.
can get the service.
Yes.
I think I can start this, and then my name is Beth Lackey, the Provider Network Director, and I think that's a great question, Maria, and we are working to ensure that we not only have services in place for members that are currently receiving services, but that we're also having providers who are asking to join the network in addition to that. So we kind of have two steps in this process, where ensuring that services that are being delivered continue to be delivered on September 1st, and then also looking at where do we have those opportunities to build out that capacity, where we are we may work with providers that are currently in the current 9 counties that want to expand services or have a contract or add sites and services to your point as we move forward. Or there are other providers that have requested to join the network so that we can do those both ways. We know that that is a pressure point, so we're trying to work in both of those lanes to ensure that adequate service coverage for members and families. I hope that answers your question.
Yes, thank you so much.
that. Wanted to add a little bit about the backup staffing component too, and the education that we are doing. I think the pandemic got in the way of us doing some more education about backup staffing because of the flexibilities with the waiver. But we have provider network training about the state the obligations that providers have to provide backup staffing. So we provide that to our network, as well as we have created a training for members and families so that they understand the ins and outs of backup staffing and how to best work with their providers to ensure that happens, and to think out of the box. So we are always looking for ways to better educate both sides to create a better system there.
Thanks for the clarification, Allison. So we've got another hand raised. Jessica, if you would like to ask your question.
Hi, yes, I have. The first one is what happens with the people that right now start send the documentation of cardinal innovation for the leave the amendment? What happens with these people that need to stay in this transition?
Jessica, I'm sorry. I think we're having a really hard time hearing you. If you could maybe scoot a little closer to the microphone.
You hear me now? You hear me now?
Yeah, a little bit.
Sorry, I don't know what happened with this.
It sounds like there's sounds like you're talking in a can.
Oh my goodness.
There you are.
hear me now? There.
Yes,
Okay.
yes, hear you great. Thank you.
Perfect. Well, my first question is what happened with the people that right now start with the papers with cardinal innovation? Like they start send the papers or in the moment that September, before the September 1st, they start send the papers. What happened with these people? Because you receive the diagnostics like every day. A lot of people receive diagnostics. And if, example, I received the diagnostic in August 29 and start the process with Cardinal, what happened with these people? What happened with these families? What they need to do? Or what's the process with them?
So I think I can respond to that. And this is true for both the population that I work with, which is individuals and developmental disabilities, as well as individuals with mental health or substance use disorders. We're working really closely with Cardinal to ensure a smooth transition for members. And that includes situations like you're referring to, where something gets started shortly before September 1st, and it's really not finished yet. Maybe there's no authorization in place yet, but a clinical assessment has been completed or the process has gotten started. We're going to specifically discuss those situations and make sure that there's a warm handoff so that we can continue the process. So the Cardinal staff have been very, very helpful working with us and are very as committed as we are to ensuring the smooth transition between LME MCOs for the members. And so situations like that, we will handle with special care because something is kind of in the middle. It will be a little bit more challenging than someone who's already in service and has service authorizations in place. But we do recognize that there will be individuals in that situation and we will have to handle those in special ways. Hopefully that helps.
Yeah, and the same way the appellations. The people they stay in appellation, they say, the Cardinal say is deny, and they start the appellations, you making the same process with the
Charity, that's about
with them.
Like if Cardinal denies
Yes,
the
okay.
service and someone is in the appeal process, what happens?
Yes.
So any appeal process that has been initiated or started before September 1st will continue with Cardinal because it addresses services prior to September 1st. If there is a denial that addresses services that begin after September 1st, then you will have the opportunity to re-request those services.
And my last question is, what partners make for give more information about the partners, what is LMCO and what is the list, the amendments? Because a lot of people receive the diagnostic but don't have any direction and don't have idea what is a LMCO or what is the list, and don't put a his kids. What is cardinal? What is partners? Sorry, decide for help with this gap.
So Jessica, let me just repeat what I think you said. I think you're asking, like, how does partners go about making sure that people know what services and supports are available and how to get them? What do we do to get the word out in the community about what Partners is and what kind of services are available, and what do you do to get those services? Is that what you were saying?
Yes.
So Allison, do you want to take that one? Allison, you're on mute.
Sorry about that. Double mute. So we in member engagement and with our other department partners offer member cafes. So they're events that are monthly that we highlight either a service or a community resource that's available. We also give information of how to find our services, booklet, certain wellness apps, or any of the benefits that we offer members. In addition to that, we offer periodic service array events. So we have a subject matter expert from a different, say it's mental health services. Then the next month, we will talk about IDD services. We actually just did an annual training on IDD services. We're going to be doing them specific to state funded versus innovations. We did training for members who are on the Registry of Unmet Needs with Tammy's folks, and they talked about new service that was coming down the line that was state funded, and CLS, Community Living Supports, and they also talked about long-term community support and the changes made to day supports. Those are just examples, but periodically we always do updates and highlights for specific to members. And then, you know, I'm sure Beth Lackey and Provider Network could tell you a lot more. They offer a very robust training menu of service about different services.
Jessica, this is Beth. We do offer, as Allison mentioned, provider training of services, and then also work with providers. We have services that are coming online that they are able to offer those services and be able to roll those services out, so that we're able to educate not only our providers about various services that they may want to add, as well as work with providers who are requesting to be able to deliver services or come into the network, and then Allison does have a robust training for members and families that she does outreach. So I think if there are opportunities that we have to have any additional ideas on the best way to meet, getting the word out to members or making sure that we're expanding those educational opportunities, we would love to have that feedback.
Beth, I would just like to add, this is Tara Conrad. I'm the Director of Community Engagement. Jessica, I would also like to put a plug in for the collaboratives Ms. Brindle talked about. Our team in community engagement, we constantly do email blasts out to our community collaborative groups, and a lot of our community engagement activities that we do and our stakeholder groups and different activities we're involved in. We also do a lot of training within community engagement, and we provide resource lists and different opportunities to inform stakeholders and members about the resources and services available to our members.
Jessica.
Go ahead, Shirley.
I just wanted to add that, Jessica, especially through CFAC, we take every opportunity to welcome guests to speak to us about particular subjects of interest to our members and our community. And many of the panelists here tonight have spoken to our CFAC, but we also invite individuals from the state and from other community affiliates to speak at our CFAC. So we will be encouraging that as the fiscal year begins to have additional guests. So please don't hesitate to make known to us those the information that you would be really interested in hearing a little more about.
Jessica, let me jump in. I'm Rachel Porter. I'm the Chief Administrative Officer for Partners. And hi, Jessica, it's good to hear your voice. And you've heard me say this before, but for everybody else's benefit, on a very basic level, please encourage folks to follow us on social media. We're very active on Facebook. We're very active on Twitter and on LinkedIn, and to visit our website frequently. There is information that's updated sometimes every day, especially around county realignment information and the frequently asked questions, and then also basic information about services that we offer. So please do encourage, that's a simple thing to do, is just sort of click on a like and check in and follow us, because we really do funnel important information there. Thanks for being here tonight. I appreciate it. And I'm sure I'll talk to you soon.
Yes, thank you. And only one more thing. All that you say is wonderful. And I really appreciated today put interpretation in Spanish. I really say thank you. But also, encourage for all these activities and things made in Spanish too, because Union County is one of the counties that have a lot of population in Spanish. And thank you so much.
We appreciate that, and some of the comments have been so helpful to us to improve what we're doing to support language accessibility and other needs. And so we always want to elevate the community voice through community engagement, member engagement, care management, all of our member and family community touch points. So thank you for that. And we don't always get it right, but we're always trying to improve. I will say that. And luckily, we have quite a few Spanish-speaking staff and growing too. So we'll have a member engagement specialist soon in your counties who also speaks Spanish, and hoping that she will do a lot to help us just further improve communications and awareness and services and empowerment for families so that they can have access to everything they need. I'm trying not to embarrass that person. who is here, but.
Thanks, Allison. So Jessica, thank you for your question. I do want to go back quickly. I know, Ashley, you have your hand up. I think that Maria, you had a second question as well. So I don't want to forget about you. If you still have your question, just go ahead and raise your hand again and we'll call on you. But I did want to go ahead and remember that. I want to read one aloud that came in from Miss Miller. And she says, it is my understanding that Davidson and Stokes are asking DHHS to transition to Partners. Is Partners talking with any other counties? And Rachel, while we had you, I just wanted to go ahead and give that one back to you.
I'm happy to address it. Thank you, Mary, for the question. I appreciate it. You've been very helpful in asking questions and inquiring of us over these past weeks. So at the beginning of this month, the beginning of June, Cardinal and VIA announced that Cardinal would be rolling their operations under the management of VIA over the next probably year or so. And we all know that several of, I guess it's six of Cardinal's counties have already begun a realignment process and are in different phases of that process. The Secretary of the Department of Health and Human Services suggested to the remaining counties that if they wanted to move forward with VIA, they certainly could. If they wanted to choose another LME MCO, they could do that too. That she hoped to know what they wanted to do, what the county intentions were by today, by the end of June. And so there has been a sort of scramble by the remaining counties to get to know other LME MCOs and such. And so, yes, there has been conversation with those counties, with some of those counties, with us and with the other LME MCOs. We've kept our existing counties and our new counties very closely abreast of what's going on with that, because we're sensitive to the fact that this is a brand new development and that it's sort of felt a little chaotic to folks. So we've tried to sort of keep that in check. But I want to underscore, and this is a partner's perspective, we really do strongly believe in the cornerstone of a regional model for the LME MCOs. We believe that that's important. We believe that care that is delivered locally is important, and that contiguous or nearly contiguous areas are valuable to the effective functioning of this model. And so we believed, and in conversation with other LME MCOs, also believe that we need to sort of figure out how to maintain that regional model if necessary. And so we did have, gosh, the days are running away from me, but I believe yesterday, Davie County Board of County Commissioners did vote to realign with Partners. And there has not, as far as I know, there's not been another, and the county commissioners must decide that. It's up to them. They would get a recommendation and consider it, but it would be up to them. So the only other one that I think is close to that might be Davidson. And I understand that their intention is to realign with Sandhills. I don't know where they are in that process though. There again, today has been, it's been a busy day because this has been the deadline day. And so there'll be more news to come about that. I know there are lots of rumors swirling around and, lots of speculation and such. I tend not to move ahead with any sort of announcements or confirmations until the Board of County Commissioners has officially voted. Now, we also don't know what the approval process will look like, or that transition process. Since this is a unique situation, we are waiting for some direction from the department about what happens next. But we will, again, stay up to date with our website and our social media, because we make announcements there first. We follow county, we let the counties take a lead. And I will say, you know, Partners is not looking to get bigger for the sake of getting bigger at all. In fact, after we moved forward with Forsyth, we sort of said that's where our stopping point is. But then we had this new development and you know, wanted to consider what we needed to do to maintain that regional model. But I don't think that you'll see Partners getting much more expansion right now. There might be a little bit, but it's not going to be a big sort of expansion in one way or the other in the state. But we commit to informing you in the moment as best we can. I really appreciate the question. It's timely, as you can imagine. It's been a big deal today, so I really appreciate you asking it.
All right, guys, we've got some really good questions tonight. Does anybody else have any other questions they would like to ask? We're happy to make as much time for you as we need.
I think Ashley has the question.
Hello. Yes, I do. So, and are we at time? Are we ending at 7?
No, ma'am.
7:30. So go ahead.
Oh, 7:30.
Yes.
Okay, cool. So I do just have a couple things. So one, who in Partners would offer like an advocate type service for attending IEPs alongside with parents? Because when Jessica was asking her questions, I understood her to be talking about like after a diagnosis happens, and we know that diagnosis happens when the school says, hey, you know, we noticed something, you know, challenges or whatever, maybe you should go get your child tested or however it happens. Or, you know, the parent then goes to the doctor and says, hey, you know, I noticed something, you know, some challenges with my child, like, can we pursue this? So they get it from either they notice and they go straight to the doctor, or the school, the teacher says something to them and then they go to the doctor. So once you get the diagnosis, like I understand that, you know, there's a whole lot of like member opportunities and member benefits and things like that, but like how does a parent get from the diagnosis to Partners? Like what does Partners do, like either at pediatricians' offices or at schools, like to kind of help like those next steps?
So this is Tammy again. So that's a good question. And I think the answer does vary a lot by the individual member and by the population and by the school system's preferences. For individuals with intellectual and developmental disabilities, it varies somewhat whether if you're in the innovations waiver or if you're not. One of the things we really try hard to do.
I would like to assume that it's not. Like we just got the diagnosis, like what is a parent to do and what is Partners doing in the community to make sure that schools know about Partners, pediatricians' offices know about Partners?
Yeah, one of the things we do really hard, and every year we do it again, is we do outreach with the school systems, we do outreach with doctors' offices, and we do outreach with the Children's Developmental Services Agency that serves children under the age of 5 to help educate them about what Partners is and how individuals and families can connect with us. Because we can't be everywhere. We have to depend on them to give individuals and families the information on how to contact us. So we get a lot of referrals from school teachers and from school social workers and from doctors' offices, and occasionally from the CDSA, the Children's Developmental Services Agency. And usually it starts with a phone call. You know, someone on our team talks to the individual or parent on the phone to talk about services. We don't expect the school system to know all the details about all of the services available and what the requirements are and how to get them. We just want them to understand that there are services and supports available and that we depend on them to help individuals and families connect with us, to know that we even exist and what the phone number is, and potentially to help them make that first phone call. Occasionally we get a call from the school system or a doctor's office and ask us to reach out to the family. Maybe the family's not comfortable making that cold call. I'm like, I don't even know what to say when I call them. And so instead we call the family and say, you know, Dr. Jones has given me your number, and I understand you're interested in services, and let me tell you a little bit. So we can do it either way, but that's really, you know, one of the things that we focus on is helping partner with the school system and physicians' offices and DSS and the CDSA and the health department even to help get people connected to us.
That is
And
fantastic.
I would further add that we have such a close relationship with our IDD stakeholder groups, such as Autism Society and all their regional trainers, support the resource support folks, as well as Family Support Networks, the ARC, Exceptional Children's Assistance Center, who do a lot of trainings for families about advocacy in the IEP meeting that you mentioned. They have a lot on their website. They do live trainings. They have some support people. And we really make sure that families have that information, and working with care management departments, working with people in the community, working with community engagement at the transition fairs, you know, as an example. Those are some other examples. We also create publications. We have the roadmap to the Registry of Unmet Needs that we distribute in the community. That is a step-by-step guide, and we offer trainings to help people find services while they wait as well.
Wonderful, and that's awesome. So specifically to the new counties that you're picking up where those relationships are not established yet, how quickly do you think that you can deploy and start developing and fostering those relationships with the community people and the Autism Speaks and Autism Society that you reference?
Great question, and we've already started. So we just did a training for the Autism Societies, all the regional specialists actually across the state, and in our counties and in the expansion counties. We've reached out to Family Support Network of Piedmont, and we have a partner with some of the providers. We've engaged with some of the providers who support IDD parent support groups, and we just did a talk with a mom-to-mom group in Union County on Monday night. So we're doing those kinds of things, and actually as soon as we have our IDD specialist member engagement person, they'll be working with other departments to engage further in those communities, having experience in those areas. Plus, I do want to mention that the partnerships we already have with those stakeholder agencies, they email us a lot. Tammy's group, Care Management, they come through member engagement asking for help with specific members in the community to get them linked with services or resources.
And I would just add that we have a meeting on the books with Smart Start already in Cabarrus. We've already established a relationship with your DHS and social services, juvenile justice, and various other stakeholders within the community. And we are constantly doing that as time moves forward to September 1st. So we are actively in your community working on that now.
That is so fantastic. I'm so impressed because like the young lady from Union County said, you know, you're authorized for services, but the local provider doesn't have the staff. You know, we in Cabarrus County, we have always had authorizations, but we have the same problem. You know, Easter Seals doesn't have any respite care workers in a 15-mile radius of my zip code. You know, and so it's just hard because you're like, yeah, oh, we have all these resources that you could be eligible for. Once you are eligible, it's like, well, now we don't have anybody to service your area. So I'm just, you know, I'm so impressed and I'm so excited. My expectations have always been very low. That way we don't get disappointed. But you guys are setting the bar high. And I, am a parent advocate here in the community for Cabarrus County because we always had to self-advocate here. And so, there's just such a need for resources and communication, and there's just such a separation of like community, education, medical, and like church. And it would just be nice to see like that finally like actually come together.
And Ashley, this is Shirley again. I'm a strong advocate for CFAC. We have a lot of expertise on our committee. We have individuals that would be willing to support you, particularly any parents that have gotten a new diagnosis. We would love to support you as you advocate for your loved one. We have a member who is an employee of Autism of North Carolina. She has assisted families with their IEPs in the schools. We also refer individuals to the ECAC, I always want to forget, I remember the acronym, but I have written down the Exceptional Children's Assistance Center. We encourage that, but in your community, for those individuals that will be on CFAC, please reach out to them and let us know what those gaps in services are so that we can share that with our leadership and try to address those for you.
Thank you so much. And Shirley, would you be the person that I would invite to attend our next Cabarrus County Parental Advisory Committee meeting?
Well, I could certainly be one of those people. I would love to talk with your group about Consumer Family Advisory Committee, probably along with some of our other panelists.
Thank you guys for all of the time and attention for my questions. I don't have anything else.
Yes, ma'am. Grateful to be so. So we have Diane has her hand raised, so we're going to call on her next, see what her question is. Diane Crescenda?
You might need help unmuting.
Hello, can you hear me?
Yes, ma'am.
Okay, thank you so much.
Yes,
So I'm Diane Cristanda, Board of Director, President for NAMI South Mountains, North Carolina. And I just want to share, I also serve Rufferton County. And when I heard about partners coming into Rufferton County, they're welcoming, their listening sessions, everything that they were doing to keep us involved, engaged, and their willingness to answer questions for us was absolutely exceptional. I am so impressed with Rufferton joining Partners Health Management. It has done a complete 180-degree turnaround. I talk to individuals who are very impressed, who are getting the help that they need, that they rarely got before. And there are webinars, there are trainings that they have that are for free. And by the way, their website is extraordinary. It's user-friendly. It has anything and everything that you need to know. They also have other services that I'm sure they'll share. I just wanted to share that information. I am also serve on CFAC with Partners Health Management as a family member, again, representing Rufferton County. Shirley Moore is exceptional as our liaison. She goes back and forth with us. She listens. We have a very strong CFAC of individuals coming together who may be family members, have a lived experience. We share so much on CFAC and the things that we really want to see take place for mental illness and for our loved ones. So I just wanted to introduce myself to all let you know how impressed I am with Partners. And Rhett, when he spoke earlier, his words were well spoken, folks, but really everything that he said was truth because I've seen it firsthand. If you ever need anything, need any help or anything like that, please feel free to reach out to me as well. But thank you, Partners Health Management. Welcome, Cabarrus. I am so happy that you are joining Partners. And you know what? They're top notch. Thank you.
Thank you so much for your kind words. It very much appreciated. Thank you for your support. It's very greatly appreciated. All right, folks. Oh, well, nope, that's just Abby. Never mind.
No, I have one that has
Oh,
come into
okay,
the
never
chat that
mind.
I'm going to read out loud. Don't ignore me. Okay,
Sorry,
that's okay. We had a question from Gannett Hartman, and she's asking for children that are diagnosed and maybe even on the wait list, is there any support offered for those children if they are not on Medicaid?
So Tammy, you want me to answer that one, or you all want to answer
I was
it?
thinking that Charity might want to respond to that.
Charity?
Your
Okay,
pictures keep
great.
moving, so I was looking for Charity.
I'm
I
here.
know they do. They're assisting.
And I want to make sure I heard the question properly. You are asking if there are resources or services available for people who are on the wait list but do not have Medicaid. Did I hear that correctly?
Yes, I'll read it one more time just to be sure, but it says, for children that are diagnosed and maybe even on the wait list, is there any support offered for those children if they are not on Medicaid?
We do have services that are available to folks who are not on Medicaid. However, there is some limited funding with those services, and we do have an eligibility process. One of the things that we do is work with our members to see if children are eligible for Medicaid. We have very few children in our network who are in our membership that are not eligible. So that would be one step that we would want to take first.
There are a number of children, Charity, that are on the waiting list for innovations that their family income is too high for Medicaid, but their private insurance often doesn't cover the types of services or supports they might need. So what we do for those individuals and families is it's all so individualized. We have to know the specific situation, and we can try to help you walk through what might be available. There is a new service that some of you may have heard of called Community Living and Supports. It does not start until age 16, I believe. It's a new service in North Carolina for people who do not have Medicaid. All of the LME MCOs are still in the process of operationalizing that service and trying to determine what funding is available, because essentially the state made a new service. They didn't give you any more funding to provide the service. So we have to figure out what funding is already available to help people access that service. But it is a new service and will be helpful for some of those individuals, including the adolescents who don't have Medicaid.
Hey, this is Ashley. I thought I was done, but now I'm not. So we used to have private insurance for our son because, yes, in North Carolina, we made too much money. And, you know, I either had to quit my job or we just waited until he turned 18. Because, yes, although the services were there, like I said, they didn't have funding, they didn't have the providers, they didn't have the staff. So when he turned 18, we got the guardianship. And on his 18th birthday, we took him to social services and the movies and to dinner, and we made him an independent disabled adult. and that's when he was able to receive the B3 services while he waits on the wait list. And we're going on year 9.
That's great. Thanks for sharing that.
Yeah, no doubt. All right.
We have one follow-up question about that. Are you going to offer additional services for Medicaid recipients?
So that's a good question as well. There's a number of services that all of the LME MCOs provide, no matter where you live in North Carolina. And then there are some special services that are called alternative services or in lieu of services, you might have heard. And Partners actually has more of those services than any other LME MCO in North Carolina. It's where you can be kind of creative and say to the state, we think it's a good idea to use Medicaid funds to pay for this, and you have to give them a service definition, and you write out what it would be. And if we used Medicaid funds to pay for this, we think it would save us Medicaid funds to pay for these other services. And so the state does have to approve that, but we do have some services that are not available currently in the Cardinal area. And one of those, which is really exciting to me anyway, is long-term community supports. So long-term community supports is a service for individuals aged 22 and over who are functionally eligible to be in the innovations waiver, but they don't have an innovation slot. So there are those people that are on the waiting list. There are those people who might be currently receiving a state-funded service, but they're waiting for innovations, or they're receiving a B3 service and they're waiting for innovations. If someone 22 or over has Medicaid, we'll be able to talk to them about that service, and it would cover either residential services to pay for residential support, or a day activity of some kind, meaningful day, whether it's going to a day program or going out into the community. So some of those individuals who graduate from school at 22, they don't immediately have an innovation slot. They're so lost without the structure provided by school. This service will give many of those individuals an opportunity to have a day program or a meaningful day of some kind paid for by Medicaid while they continue to wait for an innovations waiver slot. So that's one of the ways we can get services to people who have Medicaid as they wait for innovations.
I have a question, Tammy, regarding what you just said. Do you reach out to those families, or those families need to have the knowledge about the service and this alternative service?
So if the individuals are on the registry of unmet needs, we're actively reaching out to them about the service. Like if we know who you are and we know how to contact you, we're going to reach out to you. But of course, we recognize that there are people in the community that we don't know who they are and we don't know how to reach them. So we are also working really hard to get information out in the community so people will reach out to us. We're going to be doing some training with the providers in the Cabarrus, Union, and Stanley area so that they understand the service better. And because, oftentimes families will call the provider directly to say, hey, do you have anything you can do for me? Do you have any services you can offer me? And so sometimes the providers know the individuals and families, and they can reach out to them as well. So we're going to have this service available September 1st for people in Cabarrus, Stanley, and Union. And for the individuals that are currently receiving state-funded day services or residential, we'll work with those providers to shift those people from state funds to Medicaid when possible, so that we can free up the state funds for other people.
Thank you.
Sure. Thank you.
Delton, you're on mute. Were you talking?
I don't know why, but it keeps muting itself. I don't know how that's happening. But anyways, as I was saying, it is currently 7:22. We've got a few more minutes, and I was just curious if anyone else had any burning questions that they wanted to ask, anything they needed an answer to. All right, well, I've got one that I would like to ask from our FAQs. Will partners continue to support local initiatives such as the work of MHSU and IDD advisory committees and other advisory boards?
I'm happy to take that one. Yeah, yes. Yes is the answer. Every county is different with different initiatives. That particular one is referring to a couple of groups in Forsyth County. They've got longstanding, very active advisory groups for IDD and MHSUD. And every county has something like that that might be a little bit unique that they feel is very important. And we absolutely are here to partner with and support these types of initiatives. So just communicate with us and we'll work with you to figure out how to support and sustain those groups and initiatives.
One other question I think is important to ask. Where can I learn more about the process to realign from one LME MCO to another? Just in case anybody has any questions in the future.
So, Delton, is that coming from a member family perspective or just maybe a county community leader that might be interested in that opportunity?
Both.
Okay. So there's a great deal of information on our website about the current county realignments. And within that, you can get a good sense of the kind of information that is pulled together and the way the communities are involved. But if there's some specific questions, absolutely feel free to reach out to me. I will tell you more than you ever want to know about it. And would be happy to answer any sort of specific questions at any time about current realignments or the process for realignment. Again, let me point out that the situation that we have right now with the 13 or 14 counties who are sort of deciding where they want to go, if they want to go with VIA or if they want to go somewhere else, that process might look a little bit different than the ones that we're in the middle of right now. So we're waiting on some information about that, but I'm more than happy to answer any questions that anybody might have. If somebody, Abby or somebody could put my email in the chat, I'm happy to respond to you.
Sorry, my cat made an appearance here. All right, well, awesome. So just wanted to touch base before we start wrapping things up. Does anyone have any further questions? We want to make sure that we give everybody an opportunity to speak up if they have anything that they want to know or anything they'd like to share.
Yeah, and we also want to remind everybody about the meet and greet that's scheduled on July 14th. So that's one of about 7 more opportunities to join us to get your questions answered and to hear other people's questions that might answer things that you couldn't even think of at the time, but you had the question. So the meet and greet is another Zoom event, and that is at 6 o'clock as well on July 14th. We will then have some disability specific service overview. We're going to start with the Registry of Unmet Needs. Then we're going to go to the Intellectual and Developmental Disability Services, then to Mental Health and Substance Use. And then in August, we're going to have some face-to-face events in each of the 3 counties. And you will have a chance to walk around, talk to partner staff, and get your questions answered one-on-one as needed. And it'll be like a fun, fair event, but also very open office hours kind of thing too. So we hope that'll be real fun and a kickoff to get ready for September. And your suggestions help. We've already heard from some Union County folks through email. They've had great suggestions or telling us things that didn't work well, whether it's getting certified mail or how they're communicated with. So keep those suggestions and comments and your wishes coming. And, you know, we're certainly talking about those and trying to work through them. And when you do sign off of the Zoom, there's going to be a little survey that pops up. If you would take just a quick few minutes, it will honestly not take long. It's a few questions, and then there's the opportunity to give us your contact information so that we can keep you up to date with all the events that are coming and any updates that we get from the state and, you know, any changes. So,
Allison, I just want to add to that really quickly. I do want to say we have one last question that we'll take before we end for the evening, but I do want to just go ahead and let everyone know that we're actually going to be emailing out the survey to you guys. It'll be a link this time. So it'll be a little bit different. I don't think it'll prompt them exactly after, so I apologize for not telling you prior, Allison, but you'll be getting an email. It will have a list of all of our subject matter experts that have been speaking to you this evening with their names, their titles, and their contact information. It also has links on there to our website. We have a new page that's welcometopartners.org that we're trying to capture all of this information in one place to help you navigate around on our website. So I will follow up just to say that, yes, you'll be receiving an email with some of all of this information kind of tagged together all in one package. So one last question we have from Julie Whitaker asking, will we be doing more of these as the latest counties on board?
yes, we will. And we will email everybody to make sure that you all have the all the calendar of events that we've already scheduled, and then we'll let you know as they come in more. But we will do, and we also do these every month. You're welcome to join us at our member cafe. And I did want to give a special shout out to Jessica, who works in our Access to Care, for her wonderful trend interpreting services tonight. And we really appreciate her time, and thank you all for coming. I think Rachel, you look like you were about to say something. So
how did you know? I just want to remind again that Julie and others, the event information is updated on our website and through social media. So if you want the latest, it is right there for you to see the whole calendar of events, and that will be updated as we continue to schedule with, we've got some face-to-face events down the road, and the locations for that will be coming. So do check back frequently, because that information will be the most up-to-date for you to be able to see. Thanks, Allison.
I'm going to add one more thing, Allison, to that, or to Rachel's. One way too, on our website, when you're there, there's a subscribe button that you can go in and fill out your information. And what that will do is just let us email you anytime there is something going on. So be sure to do that if you're interested in receiving those things directly.
Folks, I just want to say thank you so much for being here tonight. Thank you for participating. Thank you for your thoughtful questions, for engaging with us, and for allowing us the opportunity to answer some of those questions for you, and hopefully give you some information that's going to be helpful to you. As always, in the future, if we can be service to you in any capacity, please don't hesitate to reach out to us. Thank you very much for your time, and I bid you adieu.
have a good night, everybody. Thank you.
Allison, you're the best.
Oh, thanks, Bob. Staying in my lane.
Yeah, I was supposed to be incognito. I love you,
You're
Miss
too well
Shirley.
known.
I love
They
seeing
have-
Beth smile too.
Yep, they have the very best team at Partners. Alice, Shirley, Abby. I can't say enough about all of them there. They're wonderful.
Well, they're going to start thinking that we paid you, Diane, to come and.
Oh,
You're so
no, no
sweet.
worries.
You're our biggest
No, no worries. No worries. You're exceptional. And I know because the partnership that we have, and they're going to see it in Cabarrus County. They are going to see everything that I said speaks truth.
Well, you've set the bar very high with all that you do with NAMI and everything else, and all the time that you volunteer for our members. I tell you what, you make us look good.
Love you, Jenny.
Love
Yeah.
you too, Bob. This is Jenny. I
Hey,
just
I
want
love-
to tell you guys you did a great job tonight. I'm so proud of you all.
Oh, thank
And
you.
that means
and thanks
partner
for such a
staff.
great.
I'm so proud of you guys.
Yeah. That means a lot, Jenny.
We're proud of our feedback.
All right,
Yeah.
Bob, this is Amy. You're making me jealous. Please, Shirley.
I love you too, Amy.
Thank you, Bob.
Hey, Bob.
Yeah. We gotta
Good
really put
night.
it out there how much we love and
Yeah.
care for them all.
Yeah.
Yeah.
Happy
Love you
Thank you all
guys.
for partner staff. Thank you all.
Thank you
for
so
all your
much.
time.
Thank you so much and
Thank you.
good night. And I really
Thank you.
appreciated the translation today.
Thank you, Jessica.
Good. Thank you.
And my evil sister, Sarah, too. I can't forget her.
Stand
Goodness gracious.
Thank you for all the information. We so appreciate it.
Oh, thank you.
Bob, you're going to give them
Right.
the wrong impression. Only half of me is evil.
Good night, guys.
No, we had a lot of great voices. It was very nice to hear. So
Thank you. It was
again,
wonderful.
thank you all.
Thanks.
Good. Thank you.